Good afternoon. Not as nice as yesterday, but still pretty good for a March 11th. Um, my name's Larry Nelson. I am a Waukesha County Supervisor and proud to be co-chair of the Heroin Task Force. Brenda Dunlop are my co-chair, the executive. What's her title, Terry?
She's the associate director for Elevate.
Okay. She sent Terry and I an email that she fell ill this morning and sorry that she can't be here, but said to say hello. But it's my pleasure to officially welcome everyone. It looks like we'll still have some more people trickling in, but I know we have a jam-packed agenda. So Terry, can I go ahead and introduce the county exec?
Absolutely.
So it is my honor and privilege to introduce the Waukesha County Executive, Paul Farrow. And I want to say Paul has been a fantastic role model for anyone dealing with a problem, in that he's been willing to publicly share what he's been going through, which was not on his agenda for this year. But I believe if nothing changes, this Friday, is it, Paul, where we're going to see less of you?
Yes.
So we all want to be sending the usual thoughts and prayers, but also good vibrations Paul's way this Friday for a successful surgery. And we hope they're getting rid of the bad parts and only the good parts of Paul Farrow will be left after Friday. But we so appreciate you being here today to officially welcome us and share any thoughts that you have, Paul.
Well, Larry, I thank you very much. As you said, you guys know most know the journey that I'm on. Culminates on Friday. I have a major surgery scheduled to hopefully clear out all the cancer in my abdomen. I will tell you that I have a good sense of humor, but the anxiety and the anxiousness this week is peaking. And it's one of those where I can relate to individuals, and depending on what their journey is and their struggle is. You don't really know where to turn or what to do. But for me, luckily, I have a wonderful wife. I've got great families. I've got an incredible support network that's out there. And that's kind of where I'm going to go with you all. My hat's off to you, as I say this every single time. You are an incredible support network for individuals dealing with their challenges wherever they are on their journey. And I had a meeting with our medical examiner about 4 weeks ago. We'll have hopefully some very good news to report out as she's finishing up the cases for 24. But we're seeing a pretty good reduction in overdose fatalities in 2024. And it's a testament to the work that you all have put in, the energy, the time, the training, talking with individuals, and helping them realize that there's other ways that they can get out of wherever they are. And so I really appreciate it. As Larry says, I will unfortunately be down. The surgeon wants me out of the office, Larry, for 8 to 12 weeks. I've negotiated down to 6. So that might mean 5 or 4, and you know how I am. But it's one where I'm going to take a step back to make sure that I heal up properly so we can continue the work that you are all doing, and that I can lead this county to make sure that we get the overdose fatalities down to 0 and get families back on the road to recovery and whatever their steps are. So I appreciate it. Now you've got a pack full of agenda of things and people to talk to. So I'm going to step aside so you guys continue with that. But thank you all. Thank you for what you do every single day to make Waukesha County a great place for our families to live. Appreciate it.
So, Paul, don't be like one of those baseball or football players who comes back from injury too soon and then has a setback. we want you to take as much time as you need, and then we will look forward in 6 to 8 weeks to see the new improved Paul Farrow, which I'm predicting will be even better than the current Paul Farrow.
Well, I'll tell you, Larry, it's a heck of a weight loss program I'm going on in the next couple of days. But this will disappear, I think, after the surgery is over, as I think I've told most of the people. Because of my chemotherapy, I had a heightened cold sensitivity. So this helped protect the face. Um, the jury's still out. There are some people that don't like it. My wife likes it. So we'll see who wins when we get to the end of this journey.
All right, Paul, best of luck to you. We'll be thinking of you on Friday. And now, Terry, you're going to go to some key announcements and opportunities for us.
Yep, I will take that. And Paul, take time to recover. Thanks for being here today. All right, folks, I'm going to go ahead and screen share. While I'm settling into my screen sharing, you guys can see this okay? I just want everyone to thank my dear friend and colleague, Librada Estrada from out east. She is one of my dear friends and fellow facilitator. And we are so fortunate to have her today to help with this meeting with so many people on today. So Librada, thanks for being here today. So our goals, folks, for those of you who were in here a little bit earlier, I said we have a very jam-packed agenda, so you are going to be informed. There's a lot going on, and the first part of the first half hour of the meeting is a lot of us telling you stuff that's going on, but we couldn't get away without doing that. We just had to get that done. So staying informed. We've got some really exciting research innovations coming to us from MCW, as well as Caitlin Murphy from the Department of Health Services. So we've got some really cool things to share with you later. We're going to talk about how we can amplify our message with our new LinkedIn page, and you all are going to become part of helping us create some content that can be put out there. And then the real-time data, that's Caitlin Murphy. She'll be sharing that with us later in the meeting. And then always we are finding ways to collaborate. So when you get into these small breakout rooms, first thing, please introduce yourselves. I know a lot of you know one another now, but it's always a good time for us to do that. So the agenda, we've got key updates, some exciting action team news, and then some more opportunities for us to help out with the LinkedIn page. And learn about the Wisconsin Suspected Overdose Alert Rapid Response System. All right, so I've got a couple of Heroin Task Force updates to share with you. I'm taking Brenda's spot right now. So the first thing I wanted to share with you is that we've done a little bit of a refresh on our website. And our website, as I said, Brenda Delknap was going to be doing this, Elevate hosts our website. And not only do they host our website, but they also hired their web designer to work with us to make the changes. So we are really grateful to our partner, and that's how this whole coalition works, is with our partner support. So if you have a second, take some time to check that out. Lisa Kwiat and I worked with Brenda and their web designer to just clean it up a little bit and make it a little bit easier to navigate. So I invite you to check that out. The second thing I wanted to share with you is that we've talked about this before, but the Heroin Task Force Coalition, has a relationship with another coalition in Wisconsin called the Alliance for Wisconsin Youth. It's a very prevention-based coalition, and it's a coalition of coalitions, believe it or not. We have had a couple of people, Bree Lopez and Jody Ebbinger Bentley, who have been our representatives for us on this coalition. Oftentimes I send out grant opportunities and training opportunities. You are part of our coalition, thus that makes you, you have the availability to attend those training sessions and to apply for those grants because you are part of our coalition. So I'm really happy to say that we are going to continue that partnership. Jody is going to continue being a representative, and so is Miles. Oh my gosh, I'm forgetting. I think it's Miles Payne. I'm forgetting his last name. Joy, tell me if I'm saying the right name. From Elevate will also be a representative. So we'll continue to provide information to you about grant opportunities and training opportunities in the prevention space. And then finally, I'm not sure if Amanda De Leon is on yet. I'm just taking a quick look. She is not. I just wanted to let you know, she sent us an email and let us know that Community Medical Services in Pewaukee is going to have to close their doors. They were not, it's my understanding that there is a certain number of clients that they needed to be able to help in order to keep that particular location open, and they were not able to get to that level. CMS is still out there in a lot of places. Amanda De Leon is still a wonderful partner for us and is serving on one of our action teams, but that particular location is closing at the end of March. So I wanted to make sure that you guys knew that. Okay. I'm going to pause for a second. Questions? There's a hand raise or just unmute.
Terry, there's a question
Great.
in the chat.
We've had a lot of turnover on HTF leadership. Can we get pictures updated on the HTF website? Working on that, Jake, and I appreciate that. We've had some new steering committee people step on, so we're working on that. That's on one of our to-dos as well, Jake. Thanks for bringing that up. Great. And then at this point, I am going to turn it over to Francis Thomas, who is our Public Health Strategy Supervisor, and Kirk Yockler, who is the Clinical Services Manager, Division Manager. Okay, got it. And they're going to provide some updates on what's going on countywide that impact us. So I am going to stop sharing and pull up some of the materials that they might be using.
All right,
So-
thank you, Terry. I will go
Yeah.
first because my name was first on the slide. Once again, my name is Frances and I'm our Public Health Strategy Supervisor. I'm filling in today for Stephanie Engel, who is actually the OFR coordinator, but she gave me a nice update to report on today. So we are approaching our 1-year anniversary of our overdose fatality review being live. So that is a huge accomplishment. You'll see that we officially had our bylaws adopted on March 21st of 2024. So getting through this year and having a successful OFR has been a huge accomplishment for us. And thank you to everyone who has been a part of the OFR in any way. We really took sort of a team approach to this and used a lot of smart people on this call to make that happen. So just some highlights from 2024 with the steering committee, core OFR team, and governance team. We had over 70 people oriented to the OFR process. We had 21 partnership agreements signed, so 21 different organizations to work with us on this initiative. In 2024, we had 67 recommendations, and as of our January meeting, we're actually up to 88 recommendations. We themed those into 9 different categories. In 2024, we had 5 core OFR meetings. Since we've had another one, we've reviewed 7 fatalities and had 29 report outs. So that's data shared by our partners. So a huge success. What's coming up next for the OFR? We are having our first ever recommendations workshop. So 88 recommendations is a lot, and it's a lot to consume. So at our March meeting, which is next week, we are going to start prioritizing. And what we'll do with that prioritization is we'll share that message. So based on the people in that room and the cases that they review, out of the 88, what are the top 3 to 5 recommendations that we think are feasible to start working on? And then we hope to share those with our Health and Human Services board, with the Heroin Task Force, and with anyone that is looking for how do we take a lot of good ideas and put forth some prioritized ideas. And that's, I think, the problem with a lot of work in public health and prevention is there's a lot of good ideas. How do we decide where resources go? And so that's what we hope to do in March. And hopefully we can start talking about that more after that. So I think we have slated at the June Heroin Task Force meeting to go over those priority recommendations from the overdose fatality review. Another thing I popped in the chat was that we had a Wisconsin counties article written. So you can see that linked. It's on page 30. Huge help from Nicole Kelly helping write that in collaboration with Ben Jones and Stephanie Engel, who wasn't able to be here. So definitely check that out. Anything else I'm missing from anyone that's on OFR that you think is pertinent to tell people about? Hearing
I think
nothing.
yeah, I was going to say, Francis, the only thing I'd like to say is this is so important for the work that we're doing, because now we can take actual data and hone in on our strategies and our work to make sure that we are truly impacting it in the right area, if you will. So I think this is amazing is what it is. So thanks so much, Francis.
Thanks, everyone. I'll pass to Kirk.
Thank you, Francis. Kirk Yockler, Clinical Services Division Manager here at Waukesha County Health and Human Services, and I participate in the steering committee and the design team for the Heroin Task Force. So the Heroin Task Force is a true community coalition, as you all know. It's not a HHS driven committee, but HHS is doing parallel work. And so our deputy director had actually asked us to be able to provide updates on the work that's being done out of HHS that aligns with, complements, sometimes takes direction from the Heroin Task Force. And you just heard about OFR, which was an earlier Heroin Task Force recommendation. And so what I want to cover is the work of the fentanyl squad, which was tasked with taking action with our HHS resources following our county executive's declaration of fentanyl community health crisis a couple years back. And then also county governments along with state governments are the recipients of the opioid settlement funds, which continue to come in following those settlements. And so those opioid settlement funds actually fund a fair amount of the work that we take on, either directly or indirectly with our community partners. So the two kind of go hand in hand. So just briefly, in 2024, looking at the things that we funded with the opioid settlement funding, or things that we participated in, those included youth inpatient treatment through a contract with Rosecrans, for inpatient substance use treatment for youth that didn't have other funding sources. Also adult outpatient treatment, again, covering unfunded expenses for individuals with an opioid use disorder diagnosis. One that actually came from Heroin Task Force Action Team recommendations was started out as MAT, or a medication assisted treatment in the jail. That acronym has changed now to MOUD, or medications for opioid use disorder, more specific. And so that's been a multi-year work group that I participate in along with some other folks from HHS. And we're seeing some exciting progress there. We're on the cusp of being able to offer long-acting injectable medication to treat opioid use disorder. Looks like we'll be starting with Sublocade. That will give us the ability to continue that medication for inmates that started on it in the community. But what's new and exciting is that we'll be able to offer that to inmates that identify as having an opioid use disorder and are not currently on treatment prior to release. And we know that that saves lives. So we're very excited about that. We also funded marketing and outreach. That included interior bus ads about the availability of naloxone, television and social media advertising on the fentanyl video series. We had grants that were awarded to the stigma reduction team that created a LinkedIn page that promotes these materials, and outreach supplies and branding as well. The other thing we funded is our Criminal Justice Coordinating Council, CJCC. There's a national conference for these, and the funding is available for training for drug court stakeholders. I just learned that our DA is going to be attending this year, our new DA, Leslie, so I'm excited to hear that. In 2025, a lot of those initiatives will continue, and the opioid settlement funding will continue to support them. That includes that youth inpatient treatment, the marketing and outreach. We're funding the Voices survey and data analysis, funding in the first quarter for the Heroin Task Force LinkedIn page, and additional paid advertising and outreach. Again, funding the CJCC National Conference. We are also funding a crisis services staff. That's one position based on the amount of time that we estimate that they're involved in responding to individuals with substance use related crises. Francis can probably speak more to this one than I can, but in OFR, there's a system called REDCap, and we're funding that along with the social worker position that is primary to the OFR work. Half of a communications coordinator or a communications coordinator position to cover time that works is related to working on these projects. You may recall us talking about Pulse Point, which is that AED location app and software. We worked with our local first responders and our comm center to add naloxone to locations where AEDs were located. And so Pulse Point is another life-saving strategy. And then the Oak Boxes, you heard about those, the overdose kits. We have dollars set aside in 2025 for additional boxes while we explore other options, and using naloxone saturation and overdose data to target specific areas of the county. So that's a quick overview, but I'd offer to try to answer any questions that anybody may have about the work that's being done through the Fentanyl Squad or our use of the opioid settlement funds.
Kirk, thank you. So questions for Kirk. We wanted to give you guys a minute in case there were some questions that you had. That was a lot of information.
And if you see a hand, Terry, let me know, because I don't have the same view.
Yep, actually, yeah, I was going to say, if you want to pop him off of, we had you pinned so we could all see you. There is at the bottom of your screen under the reaction button, there's a hand gesture if you want to raise your hand. So, or anybody just unmute. Any questions for Kirk? Kirk, thank you so much. And to the county, thank you both, Francis and Kirk, for the information. It's so important for our coalition to make sure that we are aligned with all of the work that others are doing, and that they know what we're doing, so we're not duplicating services. There's too much to do and not enough resources. So this is the best way to do that. So thanks, guys, for the update. I appreciate it. Now I'm really excited to share some work of the support recovery team. I'm going to introduce Sonia Garza from Rogers Behavioral Health and Anne Marie St. John from Parents Place. And they're going to share a wonderful workshop that we want you to pass out far and wide if you can. That's going to be hosted at Rogers, and a parallel path, if you will, that Parents Place will be sponsoring. So I'm going to just share my screen, and Librada's going to put the flyer into the chat, and it was also attached to your agenda. And if you need me to get it to you, please just let me know. And Sonia, you're on.
Good afternoon, everyone. I am Sonia Garza, the Community Relations Liaison from Rogers Behavioral Health at the Oconomowoc campus. And I am excited to share this awesome opportunity, Strength Over Addiction Recovery Workshop, so SOAR. And it is going to be held at the Oconomowoc site at the Laddish Center on Saturday, May 17th. So what it is a free full-day workshop for children ages 5 to 16 who have parents and or caregivers who are struggling with substance use issues. The program offers the kids fun activities to help them build confidence, resilience, and community. Lunch is provided for free. A caregiver is required to stay on the premises during the duration of the program. Caregivers can choose to attend parenting program or the free friends and family program, which includes some psychoeducation about the disease of addiction and co-occurring mental health, tips for healthy communication, and introduces participants to community-based support. It includes guest speakers from Al-Anon and AA. We are also going to have an opportunity for volunteers. We are still trying to identify what the tasks would be.
Mhm.
So once we do that, then there will be a Sign Up Genius link. And then those tasks could be things such as sitting at the info booth, helping set up tables, maybe serving lunch, things like that.
Awesome, Sonia. Thank you. This team, the support recovery team, has been working on this for a while, and one of the things that was holding it back was finding a funder, and so they were able to find a funder and move this forward. So this is really exciting. They've been working on this a while. So while that is going on, Anne Marie.
Anne Marie St. John. I'm the Community Education Coordinator at Parents Place. So while they are working with the children, we will offer opportunities for parents to build their parenting skills. We're going to use the Triple P program, which is an evidence-based program that was developed in Australia. It's been around for over 30 years now. It's an approach that gives parents and caregivers tools and strategies to raise children in environments that are safe and loving and predictable. So it's tailored to support every family by improving those parenting skills and confidence. And it doesn't tell you how to raise your children, but it does tell you strategies that you can use. So the three programs that we're going to use are the seminars, and these are just a light touch access to get parents and caregivers started on the program. So we're going to do the power of positive parenting, and that's going to focus on building strong family relationships and creating that positive, supportive home environment. We're also going to do raising confident, competent children, which is going to provide tools for developing social, emotional, and life skills, and is going to cover how children become independent and responsible and resilient. And then finally, our Raising Resilient Children discusses strategies to help children develop coping skills for dealing with stress and setbacks and challenges. And it's going to help parents then support their children in managing those big emotions. Each of these are an hour and a half long, and we'll offer it to any parent who wants to join.
Fantastic. Thank you so much. I'm going to pause for a second. We'll take you off the spotlight and see if we have any questions. This is really important for to please pass along to those who you think could use benefit from the workshop and this experience. And of course, we'll send out information about volunteering that day as well. Questions for Anne Marie or Sonia? Great partnership between our community partners. Thank you guys for doing all this hard work. All right, fantastic. It is now my pleasure to introduce or reintroduce, because a lot of you have been working with Jessica Ulrich from, is it Ulrich or Ulrich? Am I saying that wrong?
It's Ulrich.
Ulrich, got it. Wonderful. From the Medical College of Wisconsin, she has been involved with the Heroin Task Force for some time, sits on one of our action teams, has been a great partner. I know we've talked to you a lot in a lot of different ways, and she's going to talk about the new Center for Substance Use Research and Intervention, which you are now the coordinator for, it's my understanding.
Yep.
All right, fantastic. I am going to share my screen.
All right. So like Terry said, my name is Jessica and I'm with the Medical College of Wisconsin. Outside of being the coordinator for this new center, I also work on the Milwaukee County OD FAST, which is our version of OFR. And I'm also a part of the OFR state support team. So you can go to the next slide.
You bet. Oops. There we go.
So this center, we recently added "and intervention" to our name, is really new to MCW. And the reason we decided to form a center is because we noticed that across MCW and also at other local institutions, a lot of people were doing substance use research, but there wasn't one place to bring us all together and actually talk through our projects, talk through changes, like implementation changes. We weren't really collaborating, and we just had no idea that other people existed and were actually in the same space as us. So we figured a center where we can bring all of these people together to work collaboratively would be a huge benefit to the community. Next slide. So who are we? We are 35 faculty, clinicians, staff, and students from MCW. We also have some folks from Marquette University and the University of Wisconsin-Milwaukee. And we're not just in a few departments. We've got a wide range of departments that people come from. So we have the Institute for Health and Equity, Emergency Medicine. We have some clinicians that are in family med or general internal med. Some people from pharm and tox, psychiatry. So we really discovered that there's a lot of us, and we don't know who all is truly doing this work. We know we're missing bench scientists, but we have a lot of different perspectives on substance use, and we all have a wide variety of experience and backgrounds. So next slide. So how we got started. We started actually back right before COVID. It was 3 of us who met in a small conference room and started to plan the center. We steadily grew every month. We were meeting monthly, and we were really trying to get the center off the ground. But with COVID, things were put on the back burner for a few years. And then in July of 2023, we did strategic planning sessions. And then in March of 24, we did implementation planning. So this was really laying the groundwork for the center, what we wanted it to look like and how we were going to achieve our goals. And then in July of 2024, we actually received 5 years of funding through the Emergency Medicine Department to start the Center for Substance Use Research and Intervention. So with that money, we were able to hit the ground running. And we've been doing a lot since last July. In December, we held a community launch event where we officially launched the center to the community. We have subgroups that are doing work in the background, but we are launching our first community advisory board meeting in April. Next slide, please. So as a result of all of that planning that we did, we realized we had 5 strategic priorities come out of it. We want to help eradicate stigma, establish ourselves. Who are we and what's our center identity? A big part of the center is collaborating with the community to develop and guide the center. We also want to promote research that involves multiple fields and also benefits the community. And then we also want to help expand capacity for prevention and treatment. Next slide, please. So those strategic priorities have informed what we call cores. These will develop into divisions, but right now we're calling them subgroups. So education and training. How do we reach future clinicians, future practitioners, and how do we get them educated on substance use? What kind of training are we offering? Because there's still stigma that exists, and we need to be training our future doctors and nurses and practitioners about substance use, what it is and how it's treatable. The next subgroup is clinical care and treatment. So how do we expand our prevention capabilities, and also how do we expand treatment, and how do we get more people not only into treatment, but how do we increase the number of providers that are able to prescribe MOUD? Our third core is in community engagement and advocacy, which I'll be talking about a little bit more. And then the last core is research and data science. So next slide, please. So what we're envisioning for the community engagement and advocacy core is we really want to be a hub for collaboration. How do we bring together community members who are doing a whole lot that we don't know about? How do we bring them into one space and help them collaborate better? We also want to do direct consultation with any community agencies that are open to it or they want that, offering technical assistance. We've put in bids to be evaluators of different things. How do we help agencies do what they're doing and reach more people? And like I said, we are forming a community advisory board, and that is really so we know what the community wants and what it needs. So how do we have these community agencies guide us? Because we don't want to be doing something that isn't needed. So we need input from the community to know what's needed and how we can help move things along. And then the last thing that we're doing is a community newsletter. We're still planning this, but we're hoping that it will be a way for us to not only push out things that the center is doing internally, but also highlighting what is going on in the community. And that's it. It's a big thing that we've been working on for 5 years now, trying to condense it into just a few minutes. So if there are any questions, I can answer them now. Otherwise, the slides will be sent out after. And my MCW email address is on there, and so is the center email address. So either way, you'd be emailing me.
So Jessica, let's see if anybody has any questions. The question I have for you is, what is your call to action for our team? What can we do to support this work?
Yeah, so there's a few different things. Just if you're interested in learning about what we're doing, keeping up to date, you can join our community mailing list. But also keep us in mind. We're new, but we really want to help and make a difference. So if you have projects that you're like, man, we don't know how we're going to do this, how are we going to get this off the ground, reach out to us. If you need evaluation, we're here. We're trying to really be a space where we can help the community grow and not leave the community behind in what we're doing.
Fantastic. Thank you. Questions for Jessica? This is really exciting news.
Jessica, when you said about a newsletter, is that going to be a regular thing to keep people up to date on what's happening?
Yeah, yep. We haven't quite decided our frequency. I think while we're still in the beginning phases of the center, it'll be more quarterly. But for sure, that will be at minimum quarterly newsletters.
And are we, Terry shared your email and another one for the center.
Mm-hmm.
Which one should we use to say we want to sign up to get the newsletter?
Either. It's going to go to me anyway, so.
Okay.
You're the coordinator.
Yeah.
Great. So we can get I'll send that out too when I send the slides out. If folks want to be on that to gather that and get that information.
Yeah, and I didn't mention this, but one section of our newsletter will be taking these very scientific and technical publications that are kind of hard to read through and figure out what the results are. We want to take those and make them more digestible. So we're working on that. So how do we translate our research into language that the community can understand? Because not everybody has that background knowledge of like technical stuff that goes into research.
Outstanding. Outstanding. Any other comments, thoughts? This is great stuff. And you'll continue to keep us updated. So, okay,
Yep.
Great. Great. Thanks for spending time with us today. And
Yeah,
we know where to find you because you're always around.
I am. Told me.
All right, fantastic. Then I'm going to go ahead and move us along. I'm going to ask everyone just to take a second, take a breath, because now we're going to get, not that this wasn't all fun, because this was all really good information, but now we are seeking input from you guys. I'm very excited to turn this over to Lisa Kwiat, who's going to walk us through some information about our LinkedIn page. And while she's settling in, getting ready to present, I want to personally thank, and I have a slide that calls out all of our stigma reduction action team leaders who have worked incredibly hard to launch this this LinkedIn page. So we'll call them out, but this team has worked overtime for sure. So let me share my screen and we'll get you going, Lisa. And Lisa, I think I can give you slide control of, let me just see if I can do that real quick. Then you can flip the slides.
Think I got it.
I think you got it. Okay, hang on. Okay. You know what? Hang on 1 second. And you're going to flip my slides. Give me 1 minute. Where are you? There you are. Okay, Lisa, you should be able to click. Did you receive something on your end?
Yep.
Okay,
Got it. Well,
cool,
thank
huh?
you, Terry.
I forgot I could have done that with Jessica and I just remembered. Ah,
For those of you who don't know me, I am the communications coordinator at Health and Human Services embedded in the Public Health Division. So I work with Frances and her strategy team a lot. And I was honored to kind of join the stigma reduction team, helping create a sustainability plan for the LinkedIn page that has been developed this past quarter. For those of you who haven't seen that page, we put a little QR code on this slide here. You could simply hold your phone up to that QR code and it should take you right to our page and you can hit follow if you're not following already. What we're really looking for with this page is support. We would like every one of you guys to support and maybe occasionally look for some of those posts. We want people to like them. We want people to share them. That really helps stigma reduction when things are shared again and again. The sustainability plan that we are going with is coming off of Epic Creative doing the first 3 months of post for us. They really kind of created a look and a brand. They used the Heroin Task Force colors. They used our fonts and they collected some information from us, the stigma reduction team, and had designed a number of posts, I think an average of 2 per week. And our stigma reduction team reviewed those posts. And then they were live. So we tried to create a situation where they had put everything out there and we would approve it before the upcoming month. And today, what we're going to be looking for is help beyond this amazing team that is on that stigma reduction team. There's been a lot of work put in already. And as you guys know, the LinkedIn page, it's meant to be a powerful tool to raise awareness, reduce stigma, and drive action. But for it to have the biggest impact, we need more than just a handful of voices. We need a chorus. We need a lot of people. We need multiple people contributing, engaging, sharing ideas. We want to reach different audiences. We want to spark more meaningful conversations to show the true breadth of our commitment to stigma reduction. So Terry, I don't know if you want to say a little bit about some of the people in this list.
yeah, I do. These are the there, in addition to these folks, there is a team behind the chairs. But Jake, Jackie, Joy, Jessica Brost were the original quad chairs, I guess you could say, of this group. Haley is now joined as a quad chair, and then there is no way we could have done this without Nicole and Lisa's help. These leaders that you're looking at now, these folks, they understand the substance use arena, but we don't know communications. So we really appreciate Nicole and Lisa's guidance to help us with this wonderful adventure. And then I'm really excited. Many of you know Jamie Bauer. Jamie has a new position. She moved to a new position in late October of last year, but has remained on our task force list as a community member. And she reached out and said, Terry, what can I do? I want to be on one of the teams. And I went, oh, have I got a job for you? So Jamie is going to help us coordinate this content calendar so we can make sure we have at least 8 posts a month. That is the goal. So I think that's it for this page, for this slide.
Sounds good. Thanks, Terry. Before we embark on, we're going to have some breakout sessions, but before we do that, I wanted to give just a brief overview of LinkedIn. For those of you who may not go on LinkedIn on a regular basis, it's really just, it's a social network, primarily for the business community. It allows people to connect with colleagues, expand business connections, network within your industry, discuss business ideas, search for jobs, find new hires. It's really a great place to share messages, I think, for the Heroin Task Force. We can promote awareness, we can address some misconceptions, and you can even get into some open dialogue in a professional setting. I thought it was important to outline that. If anybody does have questions about LinkedIn, I'll allow for some time for that too. And I wanted to point out some differences. So the professional focus of LinkedIn isn't quite like Facebook or Instagram. It's designed for career networking. Things just seem to be a little more elevated on LinkedIn when it comes to professionalism. The content type is different too. So at Health and Human Services, Nicole and I manage the social media here. Everything we put on Facebook really isn't even appropriate for LinkedIn at times. Sometimes there's a little bit of humor involved, or it has a different personal take with some stories. We post them differently. What we put on Facebook and Instagram isn't always meant for LinkedIn. The networking purpose, I think we always want to keep in mind that when we're looking for things to post, we want people to talk about them. We want to reduce stigma. We want to showcase viewpoints that maybe help people understand something in a different way. It is less personal, more professional. Does anybody that maybe doesn't use LinkedIn very often have any questions at this time about that platform?
And if you do, just unmute.
If not, I'm hoping everybody's on and everybody's following that page right now.
I know, I can't wait to see how many more we've got. So
Right. I'm gonna check the stats after this
all right.
meeting. Okay, so moving on, we are going to have an interactive group activity to contribute to the LinkedIn page. So even though our stigma reduction team has lots of ideas, like I said before, we need a chorus, not just a couple of singers. We need a lot of ideas, and these ideas could include, something that you saw that was really impactful or meaningful to you in that world of stigma reduction. So we're going to be placed in breakout rooms for 15 minutes. There's going to be a scribe that will be assigned to take notes to guide you. And our goal is going to be to gather ideas and content to fill our LinkedIn content calendar. This should be a really casual, sort of fun meeting where you guys can talk about things that you remember that were inspirational, or if there's anybody that you follow on a regular basis that you think does a fantastic job, now would be a great time to share. So Terry, do you want to take over?
Yeah. Let me go ahead and just a couple of quick things. I'm gonna just come out of the here we go. This is what the breakout room looks like, and I'm just going to give my breakout room leaders, my scribes, they have a little dog in front of their name, so a little pup in front of their name. So I want you to please thank our wonderful scribes who are going to take notes. Scribes, I just wanted you to notice that if you move along the bottom line here of the slide, you can see the instructions are off to the side. We're going to just ask your breakout team to come up with at least 2 ideas, what the post idea might be, what images or links to images you might have. If there's someone that we should contact to get more information, our goal here is to try to come up with some really cool post ideas. So this, like Lisa said, is truly meant to be fun. Breakout room facilitators, if you have more than 2 ideas, just right click on your slide and duplicate it and just do some more if you've got time to do some more. So at this point, Labrada has us set up and ready to go into breakout rooms. Breakout room leads, look to the left-hand corner of your breakout room and go to the corresponding slide. There's a number at the top of each slide. So I'm going to pause for a second. You will automatically be put in breakout rooms. You guys have done this with us before. Any questions from my facilitators or our team? All right, let's go have some fun. Thanks, Labrada.
I'm cleaning up the rooms now, and let's see here. Some folks are jumping off just real quickly. Want to make sure.
Okay, we'll give her 1 second. That's the hard part of, she's doing the back end of it. When people leave, then she's reorganizing the rooms to make sure that we have about the same amount. You'll probably have 5 or 6 people in each room.
Okay, all right, opening up the rooms now.
Thank you. All right. What, we came up with 4 ideas. Anybody have more than 4 ideas? Okay, 3. Okay, good. All right. Our stigma team now will take this information and we will be sussing it out and reaching back out to you. I think we might have to do this again. Jake, I see you in the audience. I'm thinking we might have to do this again to get more ideas because this worked out really well. Fantastic. Any questions from anybody at this point? Okay. We are we my 5 minutes late, Labrada?
We are, and Caitlin is already here with us.
Caitlin is here. Okay, so what I'm going to do is ask everyone just to kind of take a deep breath in and out, and just stand up if you want to take a quick stretch. I'm going to stand up for a second, stand up, quick stretch, because I think we're going to go ahead and invite Caitlin right into the meeting. So just stretch for a second. So what we're doing is not having a break. So if you need a break, take care of yourself and please take your break. But I am going to introduce John Kettler, who is going to introduce Caitlin Murphy from the Department of Health Services. So John, let me share one last thing. Labrada, would you mind stopping the recording, please? Or actually leave it on for just a second. I'm going to read this into the recording. Folks, I sent this out in the agenda, but I want to call your attention to the fact that we are unable to share or post Caitlin's presentation. So we encourage you to take notes as needed. And at the request of the Wisconsin Department of Health Services, this portion of the meeting will not be recorded. So we are going to pause the recording at this time, but I wanted to make sure that you were aware of that in case you're looking for this later on. So at this point, I am going to thank you. All right, so questions for Caitlin regarding the Wisconsin suspected overdose alert system. Rapid response system. It was a lot. Go ahead. Yep, Kirk.
Yeah, hi, Kirk with Waukesha County. So, are you aware in the state of communities where, in response to the alerts, resources are being deployed in some capacity to the scene? Because that's, I think it's sometimes the alert is, okay, well, for the clients that we serve, we're going to try to make them aware, but are there any more direct actions that are happening as a result of these alerts?
That's a really good question. My initial kind of instinct response is no. I think the timeliness, it's timely, but it's not scene timely. It's not the same as I grew up in Grant County. We'll use Grant County as an example. A law enforcement officer is probably the first on the scene in the rural part of the state. And there's nothing in the system that would kind of take the place of, like, we just had 2 overdoses in 2 hours. Let's get something delivered to those, families, or the follow-up within 20. There's nothing really in that space right now. Part of the reason I would say is timeliness. The other is that the system is kind of built to discourage identifying individuals.
Mhm.
And so therefore the follow-up, the kind of overdose response strategy at the kind of person level isn't really supported within the system. So those are probably the 2 reasons I would say no. But feel free to ask follow-up questions.
So there is a question in the chat. If Waukesha County gets an alert of a spike, what are the potential responses and how is the process to decide on the response, if any? And I'm not sure who from the county would like to take that. John,
I'm happy to jump in.
Thank you.
And it's an excellent question,
Great question.
Supervisor Euclid. Thank you for that. We're in process of developing that based on both this and the Essence data. And it brings up a lot of questions. You know, what is the sort of statistically significant level for our area? And is that different? Say it's 4 in a day, it may not trip the trigger. If it's 4 in a zip code, it might trip a different trigger. So it's a very nuanced thing. So we are working on a protocol for that, and we encourage our partners to do the same. And there are some models out there of what a response might look like. One that I'm kind of fond of is NACCHO, National Association of County Health Officers, I think, has a model, and it sort of talks about different buckets of responses. Those might include like direct emails or phone calls, might be on like a social media response, might be deployment to Kirk's point, it might be deployment of increased naloxone, kind of, saturating more naloxone in a certain area and alerting maybe treatment providers in that specific area if we have kind of a certain zip code. So, what does that look like? And it kind of if then this, and if then this scenario. So we are working on that, and we would encourage everyone else to look at what seems significant for their agencies as well.
So Caitlin just popped in the chat, that's the NACCHO response, right, Caitlin? The
Yep,
suggestions,
yeah.
So she
Mhm.
popped that in there, and she also shared that with me, so I can forward that to the group as well. So thank you, John, for answering that. Great question. Jamie.
Thank you. Thank you. Great presentation. This is really awesome. I am just a community member and, a parent and social media coordinator person. So that's awesome. I have 2 questions. My first one is I noticed with the data on the website that there were a couple specifically called out substances and then like an overall group of other. And so I'm kind of curious, first, like what led to which substances were specifically called out? And then I'm also curious, like, what sustainability looks like for this, just as far as like the management and administration of it, as well as like funding and everything. I believe you mentioned like opioid settlement dollars. Is that kind of like the main funding source going forward? Things like that.
Really great question. These are like probably the questions asked so far, like the $1 million question and then the $1 million question. Like they're like such good questions. So to address your question about sustainability first, internally, we have a sustainability plan that involves all of the divisions that have been involved in the development and then leadership. So there is an administrative kind of plan. Right now, we're kind of at the point in the plan that most of the development is done. And then there are future enhancements that are currently underway. And the plan right now, or what's been approved so far, is to close. Once those are closed, we're hoping by September that the system is going to look pretty much like that, except maybe, like minor bug fixes or any, kind of disruptions in data at that point forward. So there's a little bit of staff time built in to my time and then our developers after that, but it's a pretty small amount. Okay, sorry, remind me your first question. That was an even better question.
Yeah, I was curious about your substances that were.
Oh yeah, substances. Yeah. So also a really great question. The epi side of this is actually really interesting and pretty important for interpretation. The 3 kind of really broad groups, opioids, stimulants, and benzos, are the 3 kind of categories of substances that we have what we call case definitions for. So there's a very complicated way, I think overly complicated maybe, but understandably complicated way of kind of in a hospital for a physician to say this was this kind of overdose and this is this. It's basically a diagnosis code. So if anybody's familiar with ICD-10 codes, those are like 6 or 7 digits, and they tell us exactly what happened on our body, where and why. And we don't really have that for EMS data, but we do have like kind of broader versions of that. And so it basically allows us to say, well, here's all the ambulance runs that existed, for any reason, not just overdose, any reason. And how do we pick out the ones that were overdose? So we have a filter like that kind of says, like, these are probably for overdose. Like, was naloxone administered and it worked? Or does the case, do the case notes say the word overdose in it? Or things like that. And then after that, we take all of those and we can kind of pull different features out of them. So the naloxone worked kind of one tells us it was probably an opioid. That's the easiest kind of way to tell one of the substances that was involved. Or if the patient kind of said they used this substance, then it would show up there. This is why there's a huge asterisk, right? Because our people who use drugs don't always know the types of, we have a pretty unpredictable drug supply. So all of that is saying, it'll if the word is kind of there in the record, it might show up as a stimulant, but that's not to say they actually used a stimulant. It's just what's in the record. So those three classes were picked just because we have verified and validated national definitions. What tends to happen is that we don't have enough information in the record, or none of those little like, oh, well, it said stimulant, or oh, it said cocaine, or, we don't have enough information pulled out. And when that happens, it basically is like, oh, well, it was not opioid, stimulants, and benzos, so we call it other or not specified. So that's how things get kind of thrown into that other not specified. It tends to be overrepresented, right? So we tend to see a lot of other not specified. It doesn't mean that they weren't opioid, stimulant, or benzodiazepines. It just tells us that we don't know that if they were. So we'd rather say they weren't than they were. That was a really confusing way to put it, but there is some description about the exact case definitions that we use in the technical notes under the help tab. So once you kind of are in there, you can take a look and see that, what are the keywords here that are being pulled out. But that's a really good and very important definition for a question.
Thank you. Good question, Jamie. Thanks for the questions. I'm going to share my screen real quick, just for a quick little group debrief here. If you can grab your phone, just what is one insight or takeaway that that is staying with you from this presentation? So we'll start with this question. You guys able to access it okay? Is it working? Hopefully.
Yep, came up for me.
Great, fantastic. All right, so data, timeliness of data. I'll make sure you guys have all this, and Caitlin, I'll make sure to get this to you too.
That's great, thank you. Yeah, I will say the system, because it's kind of centered on alerts and the kind of timely responses, there's only a year of data in the system, because it's not really meant to be a system of record or a system of, we wouldn't use the system to like report for a grant or get numbers like that. That's a kind of different set of use cases. So it's important to keep in mind.
Yeah, Caitlin, I'm not sure if you saw this one, the fragility and interpretation of data. I think that kind of speaks to that.
Absolutely, yep.
Okay, good. We'll let folks finish typing on this one. Able to map, power of data. Yeah, good to know the system exists, right? Right, I'll let you finish typing there for a second. And I have one more question teed up. Caitlin, while they're typing, thank you so much. Caitlin and I met, I think once or twice before. So John, thank you for the connection. And Caitlin, thank you for the time that you took to prepare for us. So thank you.
Absolutely, yeah. Thanks so much for having me. And it's great to see so many familiar names and faces.
Yeah, right. I mean, we had between 40, 45, I think our 44 was our top number here today. So that was kind of nice.
Great.
I'm going to send y'all to this next question. Just curious, and you may not have an answer yet, but as you think about the information that Caitlin shared with us today, what is one action step you or your organization could, or maybe the word should be may take or might consider taking based on today's discussion? Yeah, okay, make a protocol. What happens? Basically the question that Wayne was asking.
Yeah, that make a protocol describes protocols and then kind of sub protocols, which feels very fitting for this group. So
expanding partnerships and streamlining referrals. Awesome. Education, get involved, continue to define our response, what and when. Wow. Yeah. Review the data. I think that's the piece that when I think about the last, because I've only been with y'all since about 2021, but I feel like we're really using data to drive our decision making, and that I think I'm feeling like our work is a little bit more targeted. I will get all of this to you, Caitlin. Thank you so
That'd
much.
be so great. Appreciate it. Yeah, we're still in that collecting kind of phase. And I will be too, I should say, I know a lot of you often attend the Opioid Stimulants and Trauma Summit. I'll be there either at a table hanging out with my colleague Tom, who is does the similar work, or presenting, still not sure. And I'll also be at the Harm Reduction Conference in July.
Awesome. So I'll resend that out to everybody too. I sent that out a couple of weeks ago for registration, but I'll resend those links out too. So you can hang with us, Caitlin, if you want. We have a little water cooler discussion at 4:30. So if you want to hang, you're welcome to. Otherwise,
yeah, happy to.
Thank you. Oh,
yeah, I'll stick
fantastic.
around. Yeah,
Fantastic. So at this point, folks, this is where we usually ask if there's any updates from our community partners. So this is an agency update opportunity. I'm going to stop sharing here in case we have people that have an update. Anything anybody wants to share? We've had a couple throughout. We've had quite a few throughout. So anything anybody has? Amanda.
Terry, so sorry about the voice. I swear to you, I'm not sick. I think this is just allergies. I promise I'm not sick. I did want to share with the collective group that Pewaukee / Waukesha location is closing its doors on March 28th. Unfortunately, we don't have the census to support keeping the clinic open, which is really unfortunate. We know there's a need here in Waukesha, and maybe it was just the location. But
oops, I think we're losing you, Amanda. We are losing you, but we did actually share that at the beginning of the meeting, so the folks are aware. And if there's anything else you would like us to share, that would be great. I think we've lost her. Go ahead, Christine, you're on.
Thank you. So recently, the Women's Club of Pewaukee did approach me, their leadership, and asked if I had any connections with the current, opiate and overdose, all of that, and because they would like to try to put together like a community Q&A, maybe some people that have expertise in the area. And I said, well, I might know a couple of people. So just a thought, if anybody would be willing to speak on behalf of that, they'd like to maybe open that up to Pewaukee community for just an informational. So I thought it was kind of a neat thing, and getting out there and educating people and letting them know what's going on in our community. I thought it was great that they asked. So
yeah, Christine, I'm looking at Francis here. I'm thinking education from the public health perspective, but that's the first thing that came to my mind.
Yeah, Christine, you can send something to me and Felicia, and we can coordinate that.
Awesome. I don't know their time frame. I know that this is the upcoming president who starts in May, something that she seriously wants on the calendar. So thank you so much.
Awesome. Great. Fantastic connection. And Felicia popped in there too. Happy to assist. I am going to just screen share one more time, and Larry, I'm going to let you close us out, but I do want to invite folks if they want to hang back for the water cooler conversation. Caitlin said she'd hang a little bit too. So after the official end of the meeting, we'll hang out for a little bit.
Okay. I hope you saw on the, excuse me, the bottom of your agenda, our next two 2025 meetings will be in person. And the next one is Tuesday, June 10th, where we're going to do some strategic planning for the future of the Heroin Task Force, because it's been a couple years since we rebooted this. And we want as many people here and others who are not able to be here today to participate in that important strategic planning. September 30th will also be in person. And then December 2nd, we don't think we can count on the good weather. We'll be back to virtual. So I hope you will all put those on your calendar. And if there are other people in your organization or your community that you think should be joining us, please don't hesitate to reach out to them. We're always happy to add people to our email list. We try not to bombard people with emails, but when something important comes up, we feel the people on our Heroin Task Force list should be the first to know. I've got 4:31, so we went over a minute, but Terry, you're inviting everyone who wants to stick around, but otherwise we wish you a wonderful afternoon. And I think that wraps it up. Thank you all for coming and taking the time to be with us today.
Fantastic, Larry. Thanks, everybody. So I'll hang tight, and LeBron, I'll go ahead and stop the recording.